The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
In today's show, the link between smoking and respiratory infections, a reliable resource for cancer patients, new advances in managing diabetes, compassionate home health care, the latest technology for radiation therapy, pain relief without medication, and health advice for your pets. All this and more on Today's Health. Today's show is brought to you in part by CancerSource.com, Abbott Laboratories, Heartland Home Healthcare and Hospice, Varian Medical Systems, Health Counts, Pets Health Care Plan, the Grabber Performance Group, and an unrestricted educational grant from Pfizer Incorporated.
Prevention is such a better alternative than treatment, but too many of us fail to see the value until it's too late. Hello, I'm Robert Urich, and this is Today's Health. Preventive medicine helps us maintain our health, and fortunately, there are many new ways to help us prevent disease and live healthier.
Respiratory health is vital to our well-being, but certain factors detract from lung health and increase the risk of respiratory tract infections.
Smoking is probably the most significant contributor to respiratory tract infections. According to recent studies published in the New England Journal of Medicine, the odds of invasive pneumococcal disease associated with smoking are 4 to 1.
The chronic lung diseases that are most commonly resulting from cigarette smoking are emphysema and chronic bronchitis. But patients who have chronic bronchitis are also prone to acute respiratory infections or exacerbations of their lung disease, particularly both bronchitis and community-acquired pneumonia.
Among the antibiotics prescribed to treat invasive pneumococcal disease are second or third generation cephalosporins, doxycycline, quinolones, and extended-spectrum macrolides, such as clarithromycin, as well as azithromycin, better known as Zithromax. Thanks to recent drug developments, these new antibiotics have shorter courses and are more powerful, often resulting in less recovery time and a higher likelihood of cure. For example, Zithromax comes in a dosage control package called a Z-Pack and is normally taken twice on the first day of treatment and then once daily for 4 days, as opposed to the usual 3 times daily for 10 days that most antibiotics require. This makes the regimen more convenient for the patients to comply with and decreases the chances of missed or forgotten doses. Treating respiratory infections with these drugs may prevent hospitalization and restore a healthier lung function. With any medication, results may vary from patient to patient. Side effects and adverse reactions are possible, so if you are considering taking antibiotics, it is important to let your physician know of any previous allergies or reactions you may have had to medications taken in the past. Your physician can also advise you of any possible side effects that may occur. Antibiotics may be helpful, but remember, lung health can be optimized by quitting smoking.
Studies show that after 1 month of kicking the habit, respiratory symptoms begin to go away. 10 years after quitting, the death rates associated with smoking all but disappear. And that's a statistic we can all live with.
Information, medical research, an opportunity to talk with experts and become part of a caring community. These are all the resources we need when faced with cancer. Now technology can help you access all that and more from the comfort of your home.
The Internet. It can either be a great source of information or an overload of confusion. For patients and doctors involved in the fight against cancer, it's important to have Internet resources that are trustworthy, reliable, and easy to use.
The risk in getting information from the Internet is you don't always know where the information is coming from. Because the Internet's easy to access, there are many contributors to the Internet. Some of the information may be extremely reliable and useful. Other information may be very unreliable and may not in fact be true.
In this age of HMOs, overworked physicians, and doctor-patient visits that last an average of 7 minutes, it's hard for both doctors and patients to stay on top of the latest available medical information, especially when it comes to fighting cancer. With new strategies for fighting cancer developing almost daily, the internet can be a valuable tool for health professionals, patients, and their families when it comes to getting the most recent information on cancer.
A knowledgeable patient will have a better experience with their treatment. They'll be able to deal with the issues much more easily. They will be able to communicate better with their nurses and with their physicians.
Now there is a reliable source devoted entirely to cancer on the internet that meets the needs of both patients and professionals. Cancer Source provides a resource center where the doctors and patients can get the latest information on cancer from their own institution or practice. Cancer Source is an important vehicle for healthcare institutions and healthcare professionals to provide patients with the information they need to feel empowered and to make informed decisions. This is an equally important resource for doctors and nurses to get the latest developments in cancer treatment and research.
I have set up my own personal webpage on Cancer Source where they keep sending me new information on new research and new techniques and new procedures. So I'm constantly being kept up to date on nutritional information and everything else.
For healthcare professionals and institutions that want to provide up-to-the-minute, trustworthy information on cancer and cancer-related issues, Cancer Source provides the solution.
The best websites regarding cancer come from authoritative resources. One needs to look at where the information is coming from. If it's coming from websites that have experts in their field providing the information, then I think they can be reassured that the information is accurate.
With cancer, difficult questions are often raised, but now with reliable information at their fingertips through their own doctors and nurses, those involved with cancer can feel more confident about their decisions and exercise the empowerment that comes with knowledge.
When we return, diabetes home monitoring and home health care on Today's Health.
Someone very wise once said that it's not how long you live that counts. It's how well you live during the years you have. If we can take charge of our health and maintain it, we may be able to live better and longer. There are many good ideas to help us stay healthier. Here's one now.
More than 16 million Americans live with diabetes, and there are some 800,000 new cases of diabetes every year, 1/3 of which go undiagnosed. What's more, diabetes does not discriminate. It can strike children, adolescents, and adults.
Type 1 diabetes is an autoimmune process where the patient's immune system attacks the cells in the pancreas called beta cells that produce insulin. When a sufficient amount of those insulin-producing cells or beta cells are destroyed, then the patient can't make enough insulin to regulate their blood sugar.
The key to successful management of diabetes is blood glucose control. To manage blood glucose levels most effectively, the benchmark is blood glucose monitoring. Self-monitoring of blood glucose was once a complicated procedure, but today it is easier than ever thanks to medical advancements. Test strips, for example, have come a long way. The next generation of test strips offers pinpoint accuracy and ease of use. These new test strips, like the Precision Extra test strips with True Measure technology strips, are convenient and more accurate. The design makes the sample application a snap, whether you're left-handed or right-handed. And the patented fill trigger won't even allow the test to start until it detects an adequate sample. Now there are monitors like Precision Extra with lighting features that even glow in the dark, so the meter is always easy to see. Although self-monitoring of blood glucose is paramount to diabetes management, it's also important to assess ketone levels during periods of acute illness.
And now there's one new meter also that does test ketones in the blood, which is important for patients also when their blood sugar is higher during sick day management. Ketones come when your insulin is not doing its job, and therefore if you're not aggressive in getting yourself back under control, you could end up in the hospital, you could end up sick from your diabetes, and you possibly could end up in a state called diabetic ketoacidosis, which is life-threatening.
Precision Extra is the only blood glucose system available to check both blood glucose and blood ketone levels at home. Accurate assessment of blood glucose level allows people with diabetes to make informed self-management decisions every day, while ketone body monitoring provides valuable information for management of sick days.
With today's technological advances, monitoring diabetes is easier and more reliable than ever. Living with diabetes is no longer an obstacle to living life to the fullest.
In today's fast-paced world, we don't always have the time to take care of ourselves as well as we would like. Sometimes a little outside help is just what the doctor ordered.
Chronic illness can strike at any age. Currently, 125 million Americans live with at least one chronic disease, and that number will increase to 158 million by the year 2020.
Too often, traditional medical treatment does not address the unique physical, psychological, and spiritual challenges that come with chronic illness or an end-of-life journey. Many times, the desires and needs of chronically ill persons are overlooked or unmet.
That's why Heartland Home Healthcare and Hospice's palliative care services are designed for persons living with chronic illnesses, as well as those who are entering the end stage of illness.
People who develop chronic illnesses have needs which include obvious medical needs such as physical therapy, but they also have support needs that require psychological counseling, advanced care planning, and family and relationship support needs.
Heartland Home Healthcare and Hospice provides compassionate, high-quality home health care, a full range of interdisciplinary nursing services, and hospice care services. Their palliative care continuum clearly recognizes the importance of services such as expert pain and symptom control, psychological support, family education, and understanding individual wishes for medical treatment throughout the continuum from home health care services and into hospice care services.
Heartland Home Healthcare and Hospice has a palliative approach. It's a holistic approach. It's our promise to the client and their families that we will not only address their physical needs, but that we will support their psychological counseling needs, that we will understand their choices and their values, and that we will listen to their spiritual distress.
For Betty and Milt Bigham, Heartland's palliative home health care team helped to control uncomfortable symptoms, address fears and wishes, and develop a healthcare plan with the physician and healthcare team.
We will eternally be grateful to Heartland for managing our whole situation because, and I really don't know what we would have done without them.
While palliative care is designed to help improve a patient's quality of life, most Americans don't realize they have the access to this kind of help.
Few people know that hospice care can be provided in the home and is covered by Medicare. Heartland Home Healthcare and Hospice can help make that happen. For more information, visit www.hcr-manorcare.com.
Coming up, advances in radiation therapy and controlling diabetes on Today's Health.
Staying healthy is important to all of us, and new discoveries in the fields of science and medicine are giving us more options when it comes to our health. In our next story, we'll look at a new solution to an old problem.
When I was first told I had cancer, it was shocking.
There was a lot of fear, highly emotional for myself and my husband. How are we going to tell our children?
When the doctor indicated to me that I do have cancer, I was devastated.
Cancer. Perhaps no other single word inspires fear the way this one does. It touches virtually everyone, either directly or indirectly through a family member or friend.
There's a major breakthrough in cancer treatment from a surprising direction: radiation therapy, one of the most well-established and effective forms of cancer treatment.
For over 100 years, radiation has been used effectively to shrink or eradicate cancerous tumors.
One of the challenges we face in radiation oncology is to be able to deliver a high enough dose of radiation to control the tumor. By delivering these higher doses, we then run the risk in turn of damaging normal tissues and with the end result of higher complications.
What doctors have needed is a way to deliver radiation more directly to the cancer cells with minimal dose to surrounding healthy tissue. Now they have it. Varian Medical Systems of Palo Alto, California has developed a way of making the radiation beam smart. This smart beam is delivered with sophisticated software and a computer-controlled medical linear accelerator using a technique called Intensity Modulated Radiation Therapy, or IMRT.
Intensity Modulated Radiation Therapy, or IMRT, starts with a CT scan that is converted into a three-dimensional image of the patient. That image is put into our treatment planning computer. The computer uses a calculation algorithm that allows us to determine a way to deliver the radiation therapy by shaping the beam to match the anatomy and then using something called multi-leaf collimators, which are small leaves or pieces of metal that slide across the beam during the treatment. They modify the intensity of the beam to end up with a perfectly sculptured or painted isodose covering the tumor volume and sparing the normal tissue.
At Memorial Sloan Kettering Cancer Center in New York, doctors reported that they were able to improve cure rates in certain cases of prostate cancer from 43 to 96% by safely escalating dose levels. At the same time, complication rates dropped from 6 to 2% using this remarkable new technique.
It took less than 15 minutes. I felt nothing, just laid on the table, and all went well. I continued my daily activities. I still played golf. I still did all the things that I typically did on a normal day.
Currently, SmartBeam IMRT is being used at about 36 hospitals and clinics in the U.S., including Martin Memorial Cancer Center in Stuart, Florida. Doctors are beginning to use SmartBeam IMRT to treat patients with many kinds of cancer, including cancer of the brain, prostate, breast, head and neck, spine, and lung. Using IMRT to fight other types of cancer is also being studied.
The potential of IMRT is good news for many patients. Adding to this good news are newly adoptive reimbursement rates, which should enable many hospitals like Martin Memorial to offer this advanced treatment to their patients. For many who are facing the dark and difficult realities of cancer, SmartBeam IMRT has already become a shining ray of hope.
So I'm feeling stronger every day. I'm getting back into running again in a more regular routine, and that's important to me. And my cancer markers look good, and there's no signs of any recurrence. And so I look forward to having a great, wonderful life.
When it comes to our health, prevention can help us avoid those major diseases that can compromise our quality of life or even become deadly. It's important to know what we can do to help prevent serious diseases, and even more critical, to take action.
As Americans have become increasingly overweight in recent years, public health officials have warned of an increase in diabetes reaching epidemic proportions.
In a recent clinical study encompassing 27 medical centers around the country, researchers have determined that changes in diet and exercise can cut the occurrence of diabetes to individuals at risk in half. Those with diabetes already can nearly eliminate many complications.
Having felt the impact of diabetes in her personal life, Anna Lee Shine, a certified social worker and licensed psychotherapist, took matters into her own hands and founded Health Counts, Inc.
I decided to design the Diabetes Exchange Kit as a tool to help diabetics with their weight management, which also helps them keep in better control.
Included in the kit is a patented, handheld device that counts down the allotted number of your daily food exchanges. This counter incorporates all 6 food groups and utilizes the American Dietetic Association's and the American Diabetic Association's approved exchange lists.
It's designed as a behavior modification tool. Just helps people be aware of what they're doing. And when you do make people aware of what they're doing, it really helps them change their habits.
At www.healthcountsinc.com, anyone can get information, join discussions, and email with health professionals. Joining members can also participate in a cyber weight management program.
It's important for all of us to keep our weight in control. Finding a way to simplify the process is important because your health counts.
Next on Today's Health, wearable heat therapy and health insurance for pets. Don't go away.
Every day we're faced with new challenges that directly affect our health. Nutrition, the environment, even the weather can influence the way we feel. Now, through the miracle of modern science, we can face these challenges without fear.
For millions of Americans suffering with pain, ordinary activities can be difficult or even impossible, making life stressful. Often, dealing with pain can lead to other problems such as sleeplessness, depression, and fatigue.
For people with chronic pain or everyday aches, the option for treating the pain can be more unpleasant than the pain itself. Pain medications, including over-the-counter remedies, can have both short-term and long-term side effects. For many types of common pain, there is now a safe and natural solution to pain relief.
Heat therapy has long been recognized as a safe way to relieve pain without harmful side effects. Now, a new wearable heat therapy device called the Grabber Mycold Adhesive Body Warmer is allowing many pain sufferers to enjoy the natural benefits of heat therapy while going about their daily activities. Using a flexible adhesive air-activated heat pad, the Grabber Mycold Adhesive Body Warmer can deliver safe, natural low-level heat therapy almost anywhere the body needs it. This allows pain sufferers to enjoy pain relief while at work or play for over 12 hours. Log on to www.grabberwarmers.com and click on Pain Relief for more information.
For millions of people in pain, wearable heat therapy could be the safe solution to their suffering, and that's pretty cool.
It's hard to enjoy a high quality of life when stress is gnawing away at you. The remedy, though, can be very, very simple. Try to do something you like every day. Play with your dog, listen to soothing music, or watch a funny movie. It could make you happy, healthier, and help you live better.
In our hearts, we know that pets enrich our lives. In fact, the health benefits of pet ownership are so significant that animal owners can now qualify for the same discount on life insurance as non-smokers.
In return for their affection, we shower our pets with love and attention. Most pets receive as much attention as children and have become vital members of our families.
Unfortunately, when it comes to health care, that's where the similarities end. When faced with large, unexpected medical expenses, many pet owners are presented with the agonizing choice of euthanasia. The good news is that veterinary science has made tremendous progress in the past few years.
A lot of the treatments that we have for ourselves are now becoming more and more commonplace in the dog and cat in the veterinary hospitals. It's a lot of that's being driven by pet owners demanding more and more care, wanting to take better care of their pets. The emotional bond now with pets, they're becoming a part of the family, and they're wanting more and more and better care for their pets.
Just diagnosing a problem can cost hundreds, even thousands of dollars. Over the past few years, insurance companies have recognized the need for affordable health options to protect the human-to-animal bond.
I love him, he's part of the family, we have to euthanize him. With health insurance, now, that comes into the equation. It takes out the financial burden, and pet owners can go in if they need to have the medical treatment provided. They have insurance to reimburse them for that.
The plan can also assist in keeping your pet healthy. Preventive care benefits are available to pay for wellness care, regular checkups, vaccinations, and more. The Pets Health Care Plan offers benefits similar to those of most major medical plans. It pays 80% of all veterinary costs and medications received for any covered illness, accident, or injury with an annual deductible of $100. There are 3 plans to choose from, all of which cover the cost of spaying or neutering. The policies also offer multi-pet discounts. For more information on health insurance plans for pets, log on to www.petshealthplan.com. The site provides educational topics, money-saving tips, and links to other informative pet websites.
It's critical for people to realize the importance of health insurance before their pets are faced with a serious illness. Pet health insurance is affordable and offers animal owners peace of mind, knowing that their pet's health needs are covered.
Armed with the right attitude and proper knowledge, we can face almost any challenge with courage and success. And today we've gathered new insights on several important health issues that can impact our everyday lives. If you have any questions on any of the topics we've discussed on today's show, log on to vstar.com and we'll link you right to the source. I'm Robert Urich, inviting you to join us next time as we explore the issues that affect your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.